Inclusive health is a journey. We can all take action to remove barriers and improve access to health services for people with intellectual disabilities. But sometimes it's hard to know where to start. And that's why Special Olympics has developed 4 key strategies to help you. These strategies include welcoming spaces, communication, awareness and training, and sustainable and intentional inclusion. Welcoming spaces is one of the first steps you can take to include people with ID in your programs and services. Taking steps to ensure your programs and physical spaces are accessible and welcoming to people with intellectual disabilities is a key component to ensuring equitable access for patients with intellectual disabilities in your community. There are a number of actions you can take to make your space more welcoming and accessible for patients with intellectual disabilities, including ensuring that the physical space is accessible for all patients, including those who use wheelchairs. Patients with intellectual disabilities may sometimes also have physical disabilities. Providing options to reduce stress for patients with sensory issues. Training your staff on disability etiquette so that they know how to welcome patients with intellectual disabilities. Speaking directly to the patient, not his or her companion. Operating under the assumption that people with ID are capable of making their own decisions. Solicit feedback from your patients on the types of accommodations would be needed to better access your services. We went to some experts to see what we can learn from them. First stop, the East River Road Clinic at the University of Rochester.
We had the opportunity when this building was first constructed really to plan it with the architects from the ground up in order to make a space that is both welcoming and accessible in a variety of ways to children with intellectual and developmental disabilities as well as children with physical disabilities.
When they come here, there's no parking garage. There's no going through a lobby. They come in here and they have so many different areas they can sit in and get prepared.
A lot of our focus was on the sensory needs of our patients. So many of our patients struggle with bright lights, with noise, with too much busyness or stimulation.
They just need to go into a separate room, which we have. They have a sensory room. They go in there, there's colors and bubbles, and it's different for them, and it takes their mind off from where they are.
I like the waiting room here. I can wait patiently because I can watch TV or play with the toys.
The Complex Care Center at the University of Rochester had a similar approach.
The Complex Care Center is an interdisciplinary clinic for adults over age 19 with pediatric onset conditions. That includes intellectual and developmental disabilities, as well as a variety of other congenital syndromes like sickle cell disease and cystic fibrosis. When the center was approved to be built by the university, I first accessed my patients because they were the ones that were going to determine how it was going to be easiest for them to navigate. So that was really how we drove the design of the clinic, was based on watching them navigate that primary care setting that was built for a traditional patient population, and then revising things that we found were barriers there. When walking in the front door of the space, the waiting room is accessible and designed and assumes that people will come in chairs and canes and there's nothing going to get in their way, that the flooring directs them to the front desk so they don't have to ask how to get somewhere or be able to read a sign. Those little nuances allow somebody to be very independent in the space.
I think it's important to get to know our patients. A lot of them that we get to know, we welcome them by first name. It's important to, even the patients that come in with a worker or a parent, to address them. Say hello, say good morning, say good afternoon, and include them in the check-in process as much as possible.
I didn't really know the place so well, but when I got familiar with the place and I knew it well, I was more comfortable with the place.
My favorite part about the care center is it's very spacious, so I have enough space for my wheelchair and also other people to walk by. I feel welcomed here.
Remember, creating welcoming spaces helps not only patients with ID, but all members of your community. For more inclusive health strategies, visit www.inclusivehealthcenter.org. Everyone has the same right to health. Don't wait for someone else to make it happen. Join the inclusion revolution.